Hello, welcome to We're Engaged, the podcast that features Purdue University College of Veterinary Medicine's community partnerships. I'm your host, Sandy Sam Miguel. I'm the Associate Dean for Engagement. And this episode, I'm really excited to share our collaboration to provide veterinary care at the Indiana State Fair. So thank you both for being on the show. Really appreciate you taking the time out. And I will have you introduce yourselves.
My name is Bethany Funnel. I am a veterinarian here at Purdue. I'm in the bovine field services section, so I spend most of my time providing services to local patients and clients, local to the West Lafayette area, to our campus here. I do also teach some didactic courses as well to our first through third year students, but the vast majority of my clinical teaching is with fourth year students. Going out on the roads, making farm calls, and giving those fourth year students a chance to, play doctor for real. My goal when I teach them is to have them actually take charge of the cases and be responsible for those cases. I'm there for backup in case that they're into something that they're not certain of, or if they're struggling with a procedure. I'm basically their safety net just before we kick them out of the nest and send them out to the real world.
Thank you. And that's one thing we're really proud of, is having veterinarians who graduate who have that hands-on experience and are ready to go.
My name is Mike Berkery. I'm the Vice President and Chief Operating Officer of the Indiana State Fair Commission. And so I oversee kind of all of our operating functions, both for our year-round business as well as the State Fair, and our livestock exhibition and all that goes with that roll up through me as well. So I'm relationship manager, if you will, with the Purdue College of Vet Med.
Thank you for being on the show. I know you just come off a really busy time. Hope everything went well.
Yes, we had a great fair this year. So weather was fantastic, which helps both from a visitor perspective and a livestock perspective, right?
Yes, I've heard amazing things. So congratulations and thank you for all your work on that. Sure. So can you share about this program where we provide veterinary care at the fair? How did this come about? How do you work together? And why is this so important?
Sure. Well, excuse me, I'll just kind of start with a little bit of background on the Indiana State Fair. Obviously, we're kind of the state's largest event. We're set over 15 days now, and really like to celebrate all things Indiana with a major slant towards agriculture and youth development. Livestock exhibition has been a part of the State Fair since the inception in the late 1800s and continues to grow. We're fortunate to have a great relationship not only with the Purdue College of Veterinary Medicine, but also with 4-H through the extension, and we continue to engage youth and provide a great environment for showcasing youth development, in particular livestock. And the need for veterinary medicine during the fair continues to kind of grow and evolve somewhat too. I think Dr. Funnel would agree. But really, I think our relationship started from somewhat of a necessity to really streamline our veterinary services. Prior to working with you all, we had contracted with several local veterinarians, and it was somewhat unorganized and not centralized. You would get a kind of a different response and different type of care depending upon who you called and how those folks engaged. And so Dr. Weissman kind of used to be involved in the leadership here at the State Fair, in addition to his role there at PBM, and kind of identified this opportunity that maybe we could work together, provide students with an interesting clinical experience, and then also solve the challenge that we had of kind of like a decentralized vet services for our exhibitors. I think that's really kind of where we began. And again, it's evolved quite a bit since, in the last 10 plus years that we've been working together.
So, Dr. Funnel, what's it look like from your perspective? So, what did the students do on a day-to-day?
So with the fourth year students have an opportunity to become involved with this rotation when they sign up for their block schedules. And I usually will, it'll be kind of an application process. They have to basically say what their interests are, what they hope to gain from the state fair experience. And from there, then I can select those students that I feel are going to benefit from it. So that's basically how the process works. And what we'll do is once we arrive at the state fairgrounds, the state fair does provide us, kind of our own little space where we can set up and have all of our tools and supplies and therapeutics and everything that we need, and it's on a phone. So we have a central location where the exhibitors can call into. And I make the veterinary students the primary contact. The goal is not just for them to get the clinical experience of dealing with these, acute and urgent cases as they come on board or as they come to us, but also the client education and the customer service piece that goes along with excellent veterinary care. So they are the voice, the first face that the exhibitors see. After a call comes in, I will have the students then go out. They'll triage the situation on the phone, find out where the location is. Then I'll have them go to the stalls where the animal is, do their physical exam, get a good history. And then after that is done, then we will discuss the case. And I want that discussion to happen before they prescribe anything or suggest anything to the clients. Because, and this is something that I thought was very important, is that I don't want them to make suggestions to the client and then I come in and change the suggestions and basically undermine them. So it's very important to me that we have those discussions before we actually go back to the client and discuss what we're going to do with the patient. And so that's how we handle that. And then I'm there for the treatment unless I'm tied up somewhere else. Sometimes we do have multiple cases going on at the same time and I need to be in one place or the other. But that's one of the things that I want to do is kind of be there during the treatment, make sure that the client has shared everything, because sometimes they withhold information from students and I'm able to tease it out a little bit better just from, experience getting histories from clients. And so then we'll solidify or finalize the treatment plan and then go forward from there. And Dr. May,
yes.
So I handle 2 weeks, and then Dr. May will actually come in and handle one of those weeks as well, so I can get a little bit of a break during that time frame. So,
well, thank you so much for joining us, Dr. May. Would you like to introduce yourself? Tell us a little bit about your history here.
Sure. So I actually went to Purdue University for undergrad and veterinary school. So this experience is full circle because I actually did this rotation as a student. But I graduated 2019. I did a couple years of mixed animal private practice in Iowa. I went on to do a residency in food animal medicine and surgery at Oklahoma State. And I've been back here for about a year and a half. So I work primarily in the farm animal hospital, teaching senior veterinary students, and then help a little bit on bovine field service as well.
I love it. I love how this is full circle for you. I heard about that. Can you tell us about the most memorable experience or how it impacted you as a student, and then what you're getting out of it and able to give back as a veterinarian?
Yeah, so I was pretty passionate about the 4-H program as just a veterinary student coming in because I'd grown up in that world. I was very lucky to have that experience of showing livestock and then being on the opposite side and seeing how we care for those livestock. So this rotation for me as a senior student was really the first rotation where I felt very close to being a veterinarian. I was able to go work up cases and look at and do those physical exams and talk to those clients on my own. And sometimes we're just not able to do that in our teaching facility. So having the opportunity really boosted my confidence, and I came back to do the rest of my rotations with a lot more confidence and a lot more excitement to get to the point of graduation. And so I would say just that it was very much a turning point during my fourth year, just because I felt like I was getting close to being a vet.
That's excellent. So thank you, Mr. Berkery, for letting us be part of this partnership, and so we can have this impact on our students as well as on our community. Very much appreciated. So part of this show is to talk about partnerships and inspire others to either join our existing partnerships or start their own. So let's just talk a little bit about some of the logistics. So it's obviously a really successful relationship that you all have. So what are some key things that make the relationship successful, and how do you each benefit from the relationship?
Well, I'll go ahead and start and say that I think, the number one thing that makes our relationship between the Indiana State Fair and you all successful is really just the passion that folks like Dr. Funnell and Dr. May have for what we're doing, right? It's not just sort of transactional, right? So there's a bigger, passion and desire to not only help, out, but also to kind of make it better and understanding kind of what our mission is in terms of making, the experience for the exhibitor better. So I think, that's really helpful and makes it really easy, in all sense of the word. I think that, there's a lot of logistics that go into it. There's a lot of hours that go into it. And I think Dr. Funnell's kind of sold herself short. She has mastered the art of being in multiple places at one time during the fair, because it seems that everything happens all at the same time. And somehow it always seems to get done, and there she is doing it. So, there's a lot that goes into it, but I think if she didn't care and wasn't kind of invested in what we were doing and what we're trying to accomplish, together as a team, that would be difficult, and it'd be a different experience for everyone involved. I think the students really enjoy it because she enjoys it, and same for Dr. May, right? Having that personal experience, having been through it herself as a student, and now being kind of the leader of that for her time here, I think just sends the right message and has that students kind of making sure that they're kind of invested in it as well. So and then communication, I think we talk a lot throughout the year, right? So the fair happens once a year in August, but we're constantly working through those details, and again it's gotten easier over time because we're all the same people every year, and it makes it really simple to kind of just continue to grow. We don't have to, we kind of know what's expected of each other. We know what each other needs, and we can make us happen pretty simply anymore. But that communication is just, really, really important.
I would definitely concur. The level of communication and approachability and contact that we have with Mike and the rest of the State Fair team is just absolutely wonderful, and it just continues to improve every year. There has been a little bit of, this year was a very interesting year because there were 3 very key people involved in the State Fair that all had parental leave all kind of at the same time. So this year it kind of did have a little bit of challenges that way. But again, the years and the time that we've done this has really facilitated those processes. So we kind of know what to expect.
I think we lost her. But from your experience, Dr. May, what makes the relationship successful?
I think it's just this understanding of what the 4-H program is for, and also just having that love for livestock on our side. It's just we enjoy doing this every year, not only for the sake of our students, but it's very much where it's kind of like a family reunion where we're going and we're meeting those some of our normal clients and some of the Indiana producers that we have grown up around. And so it's wonderful to be able to give back to this program in a way that I never imagined I'd be able to. So that would probably be the most benefit that I see from this experience as well.
Excellent. So for our listeners who haven't been able to experience the Indiana State Fair, can you give us a feel for how many animals are there, the different species of animals that are there, and what are some of the cases and health issues that you're called to address?
Sure. So the statistics I'm not for sure on, but we see a variety of species. So while most of what we see is going to be cattle, sheep, goats, pigs, poultry. We also see a fair amount of horses. We looked at some rabbits this year. So quite a variety. Our program will also help if needed with, there's a dog competition as well. And so just a variety, a lot to keep us on our toes that way. And the nice thing is that we see some basic cases for our students, but we'll also see some more intense cases. So quite a spectrum that way. And it's really great for the students to manage these cases like they would in private practice, where they will be going in no time. And so it's a kind of a challenge on our side because we don't have all of our diagnostic tools that are mobile and can go down to Indianapolis with us. But it really pushes us to think outside the box with our diagnostics and with our treatment plans because we are limited on our diagnostics down there.
I'll just add in that throughout the 15 days of the State Fair, we have over 5,000 head of livestock. And that covers the gamut, as Dr. May said, from cattle and swine all the way to rabbits and chickens and poultry, et cetera. So quite a large volume of livestock. And some of the challenges too, I think that you guys have helped us with and helped not only us to continue to operate and create a safe environment for these animals. But also to give confidence, to BOA. We've been able to, avoid, major disease and sickness in our shows that have plagued some other shows, because we have your students are examining, in a lot of ways, livestock before they move into the barns, right? So that's kind of another part of the services that the students are providing is being able to ensure that everybody that's coming in are healthy, and we keep them that way, right? So that ensures that we don't have flus or other things that spread through the barns.
Excellent. That's a great point. Preventive medicine is really key. Okay, are you folks ready for the lightning round? First question is really fun, so I need smiles. You all I'm going to ask the question, and then shout out the first thing that comes to your mind at the same time, and then we'll go around and explain. Okay. First question. What is one word to describe the partnership?
Easy.
It's fun.
Oh, excellent. Tell me why it's fun.
I think it's just a blast because, we're coming from such different areas of experience, knowledge, and different perspectives, associated with the functions of the state fair, and our own different experiences. And we're able to coalesce around a common goal and a common direction. And as I mentioned, it's when you can gain everybody else's perspective and have it integrate with your own for a positive outcome. It's to me, that is just really, really gratifying. So I really enjoy it.
Excellent. What makes it easy?
Well, I think as we've discussed, the passion and shared vision here just makes the partnership really easy. Under Dr. May and Dr. Funnell's guidance, the students do an incredible job with very little resource from us and very little involvement from us. So it just makes it really easy. It's sort of one thing that we don't have to worry about is knowing that the livestock here are going to be cared for. Exhibitors are going to be happy with that care. And again, if we look at the grand scheme of the fair, it's a pretty critical part, but it's something that we don't have to spend a ton of time on because we've got true professionals that are taking the lead on it.
Outstanding. So what surprised you most about working together? Were there any surprises?
I think from my perspective was just really kind of getting a grasp and an understanding of, Mike talks about how, I'm doing multiple things at once. He's the grandmaster of doing multiple things at once and being pulled in so many different directions. And I can ask him a question about any kind of even totally unrelated topic to what we are doing, and he knows, he has the answer, and he knows the person to go to and how to get any of those details worked out. So it's such a massive event, and there are so many different parts and moving pieces. So his ability to kind of keep things organized in his head is pretty impressive.
Excellent. We have lots of masters on this show. I love it. So, do you have any advice for others who might want to develop these partnerships in other states?
I would say from my chair is don't underestimate what students are capable of, for sure. Again, we give Dr. May and Dr. Funnel a lot of credit here, but the students are really, in the thick of it, and they're running in a lot of directions too. And, a lot of times, students to some degree, are given a bad rap, but these students are professional. They care a lot about what we're doing here and trying to do it in a professional way. And they accomplish a lot with little.
Any advice from Dr. May or Dr. Funnel?
I think probably kind of going to Mike's point is the fourth year students are super excited to be there and to have the, as Dr. May said, have the opportunity to be a real veterinarian. And so, when you give them the responsibility, they take that to heart, and they will, if you ask, we need good follow through. One of the things I always tell the students is that for every case that you see, you need to check on that animal again at least once, if not twice a day. Try to time it when the exhibitor is going to be there, when they're doing chores, when they're taking care of their animals, so that you can actually communicate with them to make sure that things are progressing as they should, that the animal is feeling better, or symptoms are improving. And they absolutely do it. They almost race each other to get to those cases to make sure that they're getting the follow-up done well, and they will go back way more than what they are expected to, just to make sure that everything is going right. So their motivation and their ability to handle the tasks is the more you put on them, the more responsibility you put on, they meet that responsibility and can surprise you with their creativity and their ability to get the job done well.
It's always nice to give everybody the opportunity to step up.
Yes, absolutely.
Well, thank you all so much for being on the show. If our listeners and viewers would like to learn more about the State Fair, about Purdue's programs, where can they go?
The State Fair, they can go to indianastatefair.com. Wealth of information available there.
And a quick search of the Purdue College of Veterinary Medicine will get you to the college webpage. Both Dr. May and I are in the Veterinary Clinical Sciences group, so that will be the department that we're in if you want to reach out to us directly. You can also go to the Purdue Veterinary Hospital webpage, and you should also be able to find us there.
Excellent, and I will put that in the show notes as well. Well, that's pretty much a wrap. If you like this episode, please subscribe, rate, share with your friends, follow, do all the things. And remember that if we work together, we can change our world. So everybody, I challenge you to use your powers for good.